আজকে আমরা নর্মাল ডেলিভারির উপরে 50টি MCQ দেখব এবং তার সাথে অ্যান্সারটাও জেনে নেব। The average duration of the first stage of labor in a primigravida is 8 to 12 hours. The presenting part in a normal delivery is usually vertex. Engagement in normal delivery usually occurs at pelvic prim. Which of the following is the normal attitude of the fetus during labor? Flexion. The most common fetal position in normal labor is left occipito anterior. Which hormone softens the cervix during labor? Relaxin. The second stage of labor starts from full dilatation of cervix to delivery of body. In multiparous women, the second stage of labor usually lasts less than 1 hour. Which of the following is a normal mechanism of labor? Descent flexion, internal rotation, extension. The third stage of labor is concerned with delivery of placenta and membranes. The normal blood loss in a vaginal delivery is approximately 500 ml. Which of the following indicates the onset of true labor? Painful, regular contractions with cervical changes. Which is the best pelvis type of normal delivery? Gynecoid. The most common maternal position during normal vaginal delivery is lithotomy. When the fetal head is visible at the vulva and does not recede, it is called crowning. The active management of third stage of labor includes all except fundal pressure. Which of the following is the strongest uterotonic drug used to prevent PPH? Oxytocin. Which of the following is not a cardinal movement of labor? Abduction. The fetal head usually enters the pelvis in oblique diameter. Which stage of labor is most painful? Second stage. The fourth stage of labor lasts for 2 hours after delivery. Which suture is felt during vaginal examination in occipito anterior position? Sagittal suture. The normal duration of the latent phase of labor in a primigravida is less than 8 hours. Which factor is most important for the progress of labor? All of the above. Thepot succedaneum occurs due to pressure of cervix on fetal scalp. The normal mechanism of placenta separation is Saldes method and Duncan method. During normal delivery, episiotomy is usually given at 7 o'clock, mediolateral. Which of the following is an indication of performing episiotomy? All of the above. Which is the first cardinal movement of labor? Engagement. In normal delivery, the uterus contracts due to oxytocin. Which is the most important sign of placental separation? All of the above. In the third stage of labor, placenta should normally be delivered within 10 to 15 minutes. 33. Which part of the fetus is delivered last in a normal delivery? Shoulders. 34. Which maternal vital sign is most important to monitor immediately after delivery? Pulse and blood pressure. 35. Which of the following is true about molding of the fetal head? Normal temporary overlap of skull bones. 36. During normal vaginal delivery, which part is delivered by extension? Head. Which of the following is used to assess cervical dilatation? Vaginal examination. A cervix fully dilated in normal delivery measures 10 cm. Which is the commonest causes of DLE in second stage of labor? Malposition of fetus. In normal delivery, controlled cord traction is used to deliver the placenta safely. Which instrument is commonly used to cut the umbilical cord? Sterile scissors. How many bones are involved in molding during normal delivery? 5. Frontal, parietal, X2, occipital. 43. Which maternal hormone is most responsible for initiating labor? All of the above. Which position of the fetal head favors easiest delivery? Occipito anterior. Which part of the pelvis is most important for engagement of fetal head? Pelvic inlet. Which of the following occurs during crowning? All of the above. Which is the main danger during the third stage of labor? Postpartum hemorrhage. Which of the following is not part of active management of third stage of labor? Early cord clamping. 49. During the second stage of labor, the nurse should encourage bearing down with contractions. And last one, the best method to monitor progress of normal labor is partograph. Thanks for watching my videos and please share more and more.